I'm interested in the vagus nerve from your gut because ultimately, arrhythmias as well. Arrhythmias in your heart are an imbalance of your sympathetic parasympathetic system. So there are many factors that go into the membrane potential that is in your heart cells. One of the things about membrane potential are all the things we talked about, reactive oxygen species, because now look, you're coming on that chemistry again. It changes the membrane. Your membranes in your heart is supposed to have a charge, minus 90 millivolts. When you have all this inflammation, it drops down to around 70. So now there's a current between parts of your muscles and another part, and you're going to get these extra recurrent rhythms that are going to occur in your body. And the vagus nerve is another big one that affects the sympathetic parasympathetic system and thereby the membrane potential of your myocytes. Very important. That is why when I fix the gut, arrhythmias get better. Patients who have paroxysmal atrial fibrillation, when they come to me, the first thing I'm going to do is get rid of the inflammation in the body and ask them where the inflammation is coming from and fix it. And I find that the atrial fibrillation frequency goes down because atrial fibrillation is an inflammatory problem. It's a problem due to inflammation and an imbalance of the redox, and that's what's throwing the patient into atrial fibrillation. So I fix the metabolic underlying condition and the frequency of atrial fibrillation improves. That does not mean that they may not need an ablation, because a few patients need ablation therapy. But my point is that you are not born with ablation deficiency. You are born to have a normal physiology, and the abnormality is created by your abnormal pathology. Fix the pathology and the electrical system will take care of itself. We are electric beings. Our body is electric. Our membranes are all electric. This potential and electronic changes that are occurring as a result of reactive oxygen species and our inability to have enough reducing agents, our imbalance of sympathetic parasympathetic system is driving this process.